As humanity has evolved, health issues have evolved with us. Most of these are due to lifestyle changes, a major part of which is our diet. We simply aren't eating healthy, and honestly, it shows. Now, one of the issues that have come to the forefront is high blood pressure. Hello and welcome to our channel. Today we are going to talk about the top 10 foods that you have to avoid if you do not want to face the problem of high blood pressure. So let's begin. Hypertension, often known as high blood pressure, is a chronic heart condition that has many potential causes. Although hypertension is more prevalent among the elderly, it may and does affect persons of all ages. 1 in 4 adults 20 to 44 have high blood pressure, according to the Centre for Disease Control and Prevention. This increases the likelihood of developing cardiovascular disease and stroke. If your systolic blood pressure, the force of the blood against the arterial walls with each heartbeat, is 130 or higher, or if your diastolic blood pressure is 80 or higher, you have high blood pressure. If you have high blood pressure, you should monitor it often and consult a doctor. Blood pressure can be controlled with medication, but it can also be lowered with a healthy lifestyle and diet. So let's look at some of the foods that you have to avoid. Number 1. Salt. With hypertension, it is especially important to limit your intake of salt. Sodium raises blood pressure because it causes the body to retain more water. If you have hypertension, you should avoid putting salt in your food. Gourmet salts such as pink Himalayan salt are readily available nowadays and are aesthetically preferable to regular table salt. For someone with hypertension, however, extra salt is never a good idea. The use of salt-free herbs and spices is recommended instead. Putting down the salt shaker may cause the food to seem bland at first, but your taste buds will adjust soon. Nothing comes before your health, so even if you have to eat bland food, it's an acceptable sacrifice. Number 2. Sugar. Those who suffer from hypertension should probably watch their sugar intake. High blood pressure has been linked to several studies to a diet high in added sugars from subjects with diabetes. Avoiding additional sugar is a good idea regardless of whether or not you have diabetes. Avoid sugary drinks like fruit cocktails and other canned fruit in syrup. Find out how much sugar a product has in it by reading the label. If you're trying to lower your blood pressure, cutting back on sugar may help. Number 3. Red meat. The rich vitamin B12, zinc, protein, and other nutrient content of red meat makes it a popular dietary recommendation. Yet, it can be harmful if ingested in large quantities by people with high blood pressure. Red meat consumption has been linked to an increased risk of developing hypertension in studies, with 9.8% of hypertensive and 37% of pre-hypertensive reporting regular consumption. Research analysing 97,745 cases of hypertension found that eating red meat was associated with a higher chance of developing the condition. Every daily 100-gram increment of red meat consumption was associated with a 14% higher risk, as seen in the review. Okay, so some of the meats that you need to avoid include pork as well. So say goodbye to that breakfast bacon that you like to eat every day. Number 4. Caffeine and energy drinks. By narrowing the blood arteries in the body, caffeine is known to cause an elevation in blood pressure, regardless of the manner in which it is eaten. There is an abundance of caffeinated beverages available, including a wide variety of well-liked options, such as coffee, energy drinks, sodas, and teas. If you are going to consume something other than water, you should at least look at the label to determine the amount of caffeine it has. Be careful in your selection, as there are sugar-free sodas on the market that nonetheless contain caffeine. In a similar vein, decaffeinated energy drinks are likely not the greatest choice due to the huge amount of sugar that they contain. Regular exercise can help you feel more energized. In general, it's good for your cardiovascular health. Number 5. Bologna Salami and other lunch meats. Not only do processed meats have a high sodium content, but they also often have a high fat content, which contributes to a general decline in health. Do your research before buying any form of pre-cooked meat, whether it be from a grocery store or a deli. This goes for any kind of pre-cooked meat. Check the nutrition label on your lunch meat if you are concerned about the amount of sodium that you are consuming. If you want to make sure that your next pastrami sandwich is as healthy as possible, you could look up the nutritional information of the brand of deli meat that is sold at your neighbourhood counter and check it online. There are a number of companies that produce goods with less salt than their competitors' offerings. Number 6. Alcohol. Is it really the case that drinking alcohol might have negative effects on a person's health? The investigation into this subject has not yet resulted in a conclusion being reached. Patients who have been diagnosed with hypertension are being counselled by the American Heart Association to avoid drinking an excessive amount of alcohol, including red wine. Limit yourself to no more than 2 drinks each day when drinking alcoholic beverages. Additionally, there is a possibility that medication for the heart will interact negatively with alcohol. So check with your physician or pharmacist before you raise that glass. Number 7. Potato chips and pretzels. People who have high blood pressure should steer clear of foods that fall under the category of salty snacks as much as possible. Not only does the high salt level of these snacks contribute to the development of hypertension, but the excessive fat content of these snacks also causes weight gain and is detrimental to heart health. Modified versions of your favourite chunky salty snack that are lower in sodium and served in more modest portions can be just what the doctor ordered for those times when nothing else would do. Nuts, particularly unsalted or only lightly salted types, are a much better choice for snacking than potato chips. To maintain a healthy heart, limit your intake of sweets to portions that you have predetermined or that you have weighed. Number 8. Deep-fried foods. According to the findings of one meta-analysis, consuming deep-fried foods like French fries and fried chicken wings more than 4 times a week is associated with an increased risk of developing a number of different heart conditions. People who eat fried food on a regular basis were shown to have an increased risk of developing type 2 diabetes, obesity, and high blood pressure. In another study, 428 women between the ages of 20 and 57 were shown to have a higher association between pre-hypertension, increased blood pressure, and hypertension if they consumed a lot of fried meals. The participants in this study had an increased risk of developing hypertension. Number 9. Condiments. Table salt is an ingredient that some people choose to replace with other flavours, such as ketchup, steak sauce, soy sauce, barbecue sauce, or salad dressings. However, if you look at the labels, you'll notice that a good many of these condiments and sauces contain significant amounts of salt as well. In general, red and white pasta sauces, as well as gravy, have a tendency to contain a fair amount of salt. Before making a purchase, it is crucial to read the labels and ingredients list of condiments and sauces to see whether or not they contain an excessive amount of sodium. Number 10. Canned food. Canned vegetables, soups, and other foods often have a lot of added salt to improve flavour and extend shelf life. Vegetables, both fresh and frozen, and low-sodium soups are good options. To reduce the amount of salt in your diet from consuming canned goods, look for labels that read "No salt added" or "Rinse the food before consumption." Canned veggies and soups aren't the only processed foods that are high in sodium. Some frozen foods, such as ready-to-eat meals and pizzas, fall into this category. If you absolutely must rely on processed foods instead of home-cooked meals, try to find the ones with the lowest possible sodium content. If you suffer from hypertension or cardiovascular illness, you may find that certain manufacturers produce alternatives that are healthier. Those items might be labelled as heart healthy, and they definitely won't contain much salt. So that is all the time we have for today, folks. Hope you enjoyed this video. Do not forget to subscribe to our channel and do hit the bell icon on your way out. See you all next time.